Good evening. My name is Bailey Easton. I'm going to be your nurse today. I'm going to go ahead and provide privacy and wash my hands. Can I get you to verify your name and date of birth?
Reese, 2/29/2000.
Okay. So is it okay if I do a head to toe assessment on you? Alright. Can I get you to tell me what year it is?
2020.
Okay, and where are you?
Hospital.
Okay, so patient is alert and oriented times 3. He knows where he's at, his name, and what year it is. Okay, so now I'm going to inspect your gait. Can you get up and walk to the door for me? Okay, so gait is good. There's no swaying. It's a strong walk. Okay, so now I'm going to inspect, palpate your hair, scalp, and sinuses. Okay, so there's no patches of hair gone. The hair looks clean and good. No lesions on the scalp. Scalp is clean. So now I'm going to palpate your sinuses. Is there any tenderness?
No.
No swelling. So that's good. No swelling on sinuses. Okay, now I'm going to assess your face for symmetry. And this is cranial nerve 7. So can I get you to close your eyes real tight? Okay, open it. Small. Round. Puff out your cheeks. Okay, cranial nerve 7 is intact. Now I'm going to palpate the temporal pulse. Okay. Okay, temporal pulses are bilaterally +2. Okay, now I'm going to assess for vision in cranial nerve 2. So can I get you to cover this eye and tell me what number I'm holding up? In the upper field?
1,
Middle?
2,
Lower?
4.
Okay. Can I get you to do the same thing with the other eye? Okay, upper?
1, 2, 4.
Okay, cranial nerve is intact. Now we're going to refer to PERLA. So PERLA is pupils are equal, round, responsive to light, and accommodation. Okay, now I'm going to rate your pupil size. They are about 5 millimeters. So now we're going to assess if your the 6 cardinal fields of gaze. So just follow the pen. Okay, now we're going to check if your pupils are reactive to light. So, okay, they are reactive to light. Now we're going to test for accommodation. So, follow the pen to your nose. Okay, so eyes are PERLA. And also to assess for vision, we would use the Snellen chart, and this is where they stand 20 feet away, and they would have we would have them read the lowest line possible that they can read. Okay, I'm going to inspect your external outer ear. See if there's any drainage or anything. Okay, ears look good. Now I'm going to do the whisper test, and this is for hearing. So can I get you to cover this ear? Okay, and I'm going to whisper something, and you just repeat back what I whispered.
Cat.
Okay, and then do the same with the other ear.
Dog.
Okay, cranial nerve 8 is intact. Okay, now we're going to assess each nostril for patency, and this is for cranial nerve 1, so for smell. Close your eyes for me and tell me what you smell.
Cocoa powder.
Okay, cranial nerve 1 is intact. Now we are going to inspect oral cavity, mucous membranes, tongue, and teeth. So can I get you to open your mouth? Okay, everything looks clean. Gums are pink, teeth are clean. Oral cavity is good. Okay, now we're going to assess cranial nerves 9, 10, and 12. So for number 9, can I get you to open up and say ah?
Ah.
And this is assessing for the uvula rising, and it does rise. And to assess cranial nerve 10, if the patient can talk or if they can swallow, then the cranial nerve 10 is intact. And then for cranial nerve 12, can I get you to stick out your tongue and move it side to side? Okay, cranial nerve 12 is intact. Now we're going to assess for TMJ. So can I get you to lock your jaw and open it? Okay, and then close it. Can I get you to push against resistance? Okay. Okay, now we're going to inspect the trachea. So can I get you to lean your head back? Okay. We're going to palpate this to see if it's midline. Trachea is midline. Now I'm going to palpate the carotid pulse. So one on each side. So we'll do one at a time. Put your head down, please. Okay. Okay, and now we're going to be testing cranial nerve 11, and this is shrugging shoulders against resistance. So can I get you to shrug your shoulders? Okay. Okay, so now we're going to be assessing the lymph nodes. So can I get you to turn your head this way for me? Okay, thank you. The first one we have is the preocular, and it's located right here. And then under that we have the parotid. And then right here we have the tonsillar. Underneath the chin we have submental, submandibular. And then posterior ocular is behind the ear, occipital is below that, superficial cervical, deep cervical, and posterior cervical. And then underneath the clavicle or collarbone, we have the supraclavicle, and that's on top of the collarbone, not below it. And then those are the lymph nodes. Now I'm going to inspect your thyroid gland. So can I get you to swallow? Okay, and the gland falls and rises, which is good. I'm going to inspect from back here. Okay, now I'm going to auscultate, and we shouldn't hear anything when we do this. I'm going to swallow. Okay, thyroid gland is good. Now we're going to assess skin turgor. So I'm going to pinch the skin. And it falls, so there's no dehydration. And I'm going to assess the vertebrae. So can I get you to lean forward? We're looking for scoliosis or anything abnormal. Okay, feel vertebrae in a straight line. Everything feels good. Okay. If this were a female patient, we would instruct them on self-breast examination. And you would do this 5 to 7 days after the onset of each menstrual cycle. And then for post-menopause women, you would have them do it once a month, the same time every month. And if there are any lumps, retracting nipples, dimpling, anything like that, you would notify your healthcare provider. Okay, now we're going to test for jugular vein distension. So we would have the patient lie back 45 degrees. So can I get you to... Okay, that's fine. We were checking for any distension of the jugular vein. So as you can see, there is no jugular vein distension, which is what we want. Okay, now we're going to perform the Allen's test. So we're going to have the patient, can I have you lay your... Yes, thank you. And then we're going to put pressure on the radial and ulnar pulse. So can I get you to close your hands? And what you want is for the pink in the hand to come back once you release it. So... can I get you to release the ulnar? Oh, okay. And then I'm going to release the ulnar, and then you can see the pink comes back. Okay. And then now we're going to listen to heart sounds. So we're going to start out with the aortic. So aortic, pulmonic, Otis point, tricuspid, mitral. Okay, and now we're going to use the bell of the stethoscope to listen to the same spots. Pulmonic. Okay. Okay, there's no murmurs or any extra heart sounds, so that's good. Pulses are strong. Now we're going to assess for ratio. So we're looking for a 1 to 2 ratio. So we're going to have the patient stand up and look for symmetry. Okay, and hold your arms out. Hold your arms out. Okay. Patient is 1 to 2 symmetry, which is good. Now we're going to test for tactile fremitus. So can I get you to sit back down? And then I'm going to have you say 99 when I put my hands on you. So?
99.
Okay.
99.
Okay. And we're checking for the vibration when they say that.
99. 99.
Okay. Okay, now we're looking for chest expansion while they breathe. So just breathe normally. And we see that the chest falls and rises. Okay, now we're going to listen to breath sounds, posteriorly and anteriorly. So we're going to auscultate. Okay, just breathe in and out. Okay, now we're going to do the same thing with the back. Okay. Okay, now we're going to inspect the arms and nails. So I'm going to take arms, just look, see if everything's good. Okay, arms are good, there's no lesions, nothing wrong with that. Okay, now look at your nails. There's no clubbing or spooning. Everything looks good. Now we're going to check for capillary refill. And capillary refill comes back within 3 seconds, so that's good. Okay, so now we're going to palpate the brachial and radial pulse. So first we're going to do the radial pulse. See this? Okay, radial pulse is palpated. Now we're going to palpate the brachial pulse. So can I have you hold your arm out? Thank you. Okay, and that's okay. Now we're testing for muscle strength. So can I get you to grip my 2 fingers? Okay, strength is good. Now we're going to do a deep tendon reflex. I'm going to do this on biceps. So it's going to be right there on the bend of the elbow. And this test for spinal nerves T5 through T6. And we would use a reflex hammer, but we don't have one. So just rest the arm. Okay, so now we are going to just check the abdomen. So we'll get you to lean back. So we're just going to palpate. We're going to look at it, inspect, look for any hernias. Okay, there's no hernias. Abdomen is good. It's not tender. Have you been having any pain there?
No.
Okay, no pain, no tenderness, no redness. It's warm. Now we're going to assess bowel sounds in all 4 quadrants. So we're listening to a bowel sound in each quadrant. then if you don't hear a bowel sound within a minute, then you would listen for 5 minutes. So aortic is first. Then we have renal. Iliac. And we would also do femoral arteries, but we're not going to do that for this video. Just going to speak to that. So now we're going to palpate the abdomen for any tenderness or anything, which I already did, but you know. We're also going to look for a distended bladder. So you have you have any tenderness, any pain?
No.
Okay, and then the bladder is not distended. Okay. Okay, when was your last bowel movement?
Yesterday.
Okay, and did you have any problems with that? Was that good? Okay, and now your perineal area, is your hair distribution good? General appearance, is there any type of drainage? Okay, and then I have a male, so I would inform him on testicular self-examination. So he would cup one testicle at a time, and you would feel around for any lumps or abnormalities, and you would do this by pinching and rolling the testicular area, and that if you do find something, you would consult your physician or healthcare provider. And then urinary habits, do you have any problems urinating, anything abnormal that, okay. So urinary is good. Okay, now we're going to check the lower extremities for any edema and hair distribution. So, see that. Okay, we have non-pitting, there's no edema in this leg. There's none in that leg, and then the hair distribution looks good. And so now we are going to check the pulses. So we're going to do popliteal first, which is behind the knee. Okay, dorsalis pedis, which is on top of the foot. And then posterior tibialis, which is on the inside of the ankle. Okay. Okay, and now we're going to do muscle strength. So we're going to have him push up against the hands and then down against the hands. So push up, push down. Okay, okay, now we're going to do a deep tendon reflex, and we're going to do the patellar, and we would use a reflex hammer, but we're going to use a brush today. Okay, so we're looking for the reflex in the leg. Okay, so the last thing we're going to do is do a skin assessment, and we've technically been doing this the whole time, but we're just going to check for any abnormalities or anything wrong with the skin. And we're going to try to provide as much privacy for the patient as possible. So we're just going to look. Okay, skin looks good with no lesions. It's dry. It's warm. Don't see anything abnormal. Okay. And skin looks good, so overall the skin assessment is good. And the last thing we would do is document.